Dr. Justin Skrinsky here with a brief update on COVID-19. If you find this video useful, please subscribe to this channel to get further updates directly. First off, one of the most common questions that I'm getting now is this virus specifically targeting young people? The answer to that is no. You're no doubt going to hear tragic stories of young people who suffer and even die from COVID-19. Despite what some believe, young people are not immune to this disease, and COVID-19 can be serious or even fatal for young folks. But it's also true that young people aren't disproportionately getting sick. Let's take a look at the numbers here in Michigan. If we look at the percent of cases of who gets the virus, we see a fairly wide spread across ages, with the peak being those in the 50 to 59 age group. But let's add this second graph, which shows mortality, and we see that the percent of people who have died from the disease increases very steeply with age. In fact, the average age of someone who passes away from COVID-19 here in Michigan is 71. Because mortality is low in young people, some were falsely led to believe that none would get sick at all. As we compile more numbers here in the US, we'll be able to tell who is most severely affected. But for now, it seems like the virus is behaving here as it is elsewhere in the world, where those most at risk are over the age of 60. Now, this shouldn't give anyone a false sense of security. It's very possible for young people to still get very sick from this, and critically, to transmit it to others even if they are themselves asymptomatic. Social distancing and shelter in place are still incredibly valuable in terms of protecting those who are most at risk. Next, what you've been hearing so much about: ventilators, what they do, why they're necessary. It's important to know that ventilators don't do anything to cure the underlying virus. They're purely supportive. They simply breathe for you while your body fights the infection. Unlike other methods of giving you oxygen, a ventilator can specifically control how much air you get, how often, and with how much pressure. These are things your body obviously can't do on its own. If you're on a ventilator, you're not going to be awake. We give a combination of pain and sedative medications so that our patients are comfortable and also so that the ventilator can do its job. So what about COVID-19 is making people need this? We do know that this virus attacks the lung tissue, in particular the alveoli, which are the little air sacs deep in the lung where oxygen is getting absorbed. In addition, one of the big issues affecting COVID-19 patients is an overactivation of their own immune system, specifically a phenomenon called ARDS. You can think of ARDS as a big storm of signaling molecules in your body triggered by the infection that causes massive inflammation. This can cause dangerous respiratory failure and even death. ARDS isn't specific to COVID-19, but it is one of the more worrisome potential complications. We're finding that patients with COVID-19 stay on ventilators for a while, something like 1 to 2 weeks. So as you can tell, when somebody goes on a ventilator, that machine is tied up for some time. Now, knowing what you know, and with some models predicting COVID-19 cases to peak in the next 7 to 10 days, it's more important for us now than ever to do our part. As always, be informed, be rational, be kind, and be healthy.